Total shoulder replacement is a very effective way at relieving pain and improving function for millions of Americans whose shoulders will eventually wear out. Shoulder replacement is a very effective way of relieving pain and improving function. If you have questions about shoulder problems, an orthopedic surgeon or one of our assistants at Steindler Clinic are the best people to talk to. Your family doctor is also a good source of information about painful shoulders. There are many other treatment options available for shoulder pain. Injections, physical therapy, and other surgeries can be beneficial for some. When these other treatments are not effective, then shoulder replacement is a discussion you should have with an orthopedic surgeon who's comfortable and performs them regularly. At Steindler Clinic, we perform our shoulder replacements at Mercy Hospital in Iowa City. Mercy Hospital in Iowa City provides excellent care for both pre- and post-operative patients with joint replacement surgery. Total shoulder replacement is an operation that takes an hour and a half to 3 hours to do, depending on how hard the surgery is. For most candidates, we attempt to replace both sides of the joint. The shoulder joint is a ball and socket joint. The socket is part of the scapula or the shoulder blade bone. It's a very small piece of bone and often limits our ability to work with it because of its delicate size. The ball of the ball and socket is the top of the upper arm bone or the humerus bone in the shoulder. That ball can be replaced with a metal ball attached to a stem inside the upper arm bone. That forms the new ball of the ball and socket joint. The socket, or glenoid as we refer to it, is typically composed of an all-plastic piece, usually cemented in places, but in some instances the parts are placed without cement. It requires a lot of recovery after a shoulder replacement. While the surgery can be done in one setting, and while the recovery time in the hospital is often just 1 or 2 nights, for many patients, several weeks and even months are required to completely recover. I'm in the habit of telling my patient it takes years to wear out a shoulder and weeks to months to make it good again. It's important to have a physical therapist working with you after shoulder replacement. Our physical therapists at Steindler Orthopedic Clinic are very good at working with patients after shoulder replacement surgery and are well versed in the recovery from it. It's very convenient for us to be able to refer to the therapist notes at our visits, and we're always just a hallway away if there's any questions or concerns for our patients at our physical therapy center here at Steindler Clinic. Joint replacement is a common procedure, but it's very serious. Every surgery is very important when it's on you. Joint replacement is a surgery not for anyone, and certain medical conditions and other physical limitations may prevent you from having surgery for your condition. There are many non-surgical methods that can be beneficial for your pain.